gone on to Medicaid for institutionalization. These are staggering numbers, and the numbers are only going to get worse because we're seeing overall gains in our longevity, and we have this thing called the baby boom generation that is now entering the age of risk. And it's likely these numbers will double, so that we'll be spending 20% of our medical care costs on Alzheimer cases by 2030 if we don't find something that actually has an impact on the progression of this disease. The analogy I think we in the Alzheimer's community have decided to adopt is the one that was successful in the treatment of cardiovascular disorders. If you paid any attention, over the last 50 years, we've actually seen a reduction of heart disease as a cause of death by 50%. Just over the last 50 years. In 1960, twice as many people died of heart disease as died of cancer. Today, it's almost exactly even. And it isn't that one day you woke up in the morning and you went out and you read the newspaper headline, "Heart disease cured." That isn't what happened. Instead, it was a series of graded improvements in our ability to treat. And the key element in all of that was the idea of identifying those who are at risk, reducing those risk factors, and getting it so that these people never develop the disease. That's really been the success model that we've used in cardiovascular disease. And we think we need to do the same thing in Alzheimer's disease. And the excitement within the scientific community today is that we now have tools that are giving us the opportunity to identify those who are at risk years before they actually show symptoms of the disease. It's all based upon the accumulation of a protein in your brain that we call amyloid. This material gradually is increasing over time within your brain, and we believe it initiates a whole series of changes that result in damage to the brain, atrophy, loss of the neurons, and ultimately the symptoms that we recognize initially as memory loss and subsequently as an inability to maintain your activities of daily living. So what we're now able to do is to use new tools such as a PET scan to identify the buildup of amyloid for at least 10 years and possibly 20 years before you even get the symptoms. If you think about it, it's very much like cholesterol in your arteries. We know that you're building up cholesterol for decades before you have a heart attack. So what do? We see who has elevated cholesterol, we treat them with a cholesterol-lowering medication, and we delay tremendously the time until they actually have heart problems or eliminate it completely. This is exactly what we're planning to do now with Alzheimer's and amyloid. The way the PET scan works is very simple. Amyloid is building up in your brain, and we have a chemical that sticks to the amyloid. We attach a small, relatively benign radioactive molecule to that chemical. It's called a positron, and we inject it intravenously. And initially it goes everywhere in your body, but then it gradually gets washed out, and it only sticks where you have amyloid. So what do? We get a positron detection machine called a PET scanner. Positron emission tomography is the name for PET. It takes a picture of where that chemical is located, and the location and the amount of that chemical tells us if you have amyloid in your brain or not. It's really not that complicated a procedure. It involves 30 minutes to let the material accumulate and wash out, and then 10 minutes that you sit in the scanner in order to take the picture of where that amyloid is located. This was just approved by the FDA for general use in June of this year. So these are brand new approaches to this disease. The Bird Alzheimer's Institute at the University of South Florida, which I have the great pleasure of being in charge of, it really runs itself largely. I just kind of sit there and take all the credit, actually is what happens. But we are the first Alzheimer's Institute in the world to have its own PET scanner. There are PET scanners associated with almost every cancer center in the United States. And right now, Alzheimer patients can go to the cancer centers to get that done in most places. And increasingly, we're starting to see Alzheimer institutes start to have plans to put their own PET scanners in place. But the institute that I work at not only is there to do diagnosis, we have a multi-specialty team that will involve a pharmacist to look at drug history, that will involve a geriatrician to look at general health, a neuropsychologist to do detailed memory testing, a memory specialist physician to try and discern what type of problem you have. We have the PET scanner. We have a social worker who can help with casework and other problems in planning and managing the disease. But we also have what we call a functional assessments facility. It's a simulated environment in which we can determine the ability of someone to drive an automobile. We have a driving simulator that we can use to determine if a person is perfectly safe to operate their car or if they need to consider moving from the left side to the right side. This is a very challenging decision. It's often made without any kind of objective criteria. We can help in making that decision. We also have a falls prevention screening facility where a physical therapist has you walk on a gait mat that measures every step, how the weight is shifting on your feet. We have an inner ear device that will help determine if when the floor moves underneath you, can you adjust your balance to respond? This tells us what your risk of falling is, and from that we can then prescribe appropriate therapy or assistive devices. We also have a small apartment to look at activities of daily living. One of the biggest questions today is in the earliest stages of Alzheimer's, people can still function perfectly safely at home. But when do they get to the point that they're going to be a danger to themselves and others? And this we can do in the simulated apartment that we have. Now, these simulations are probably a little tricky for some people, and they may not do well. And that doesn't mean necessarily that it's time for them to go somewhere else. But if they can achieve this in the simulator, we're very confident in saying they'll be able to live at home just on their own. And these are the types of things we're trying to do here. To our knowledge, we have the broadest range of services of any Alzheimer's center on the planet that you can have in one day at one place, including a PET scan. So this is what I'm doing, and this is where we're going. And I think Todd's going to tell us, now that we think we can detect who's got the disease ahead of time, what might we be able to do to help those individuals in the future?
Just imagine if we had the ability to have this apartment where we could have families come in and we could test the individuals. If we could test the individuals here locally, you know, I mean, that's another dream he just gave me. But anyways, you know, it really is tough. The toughest, and that's why we want to build this going to the homes. And because there is a time, and I know Russ is going to talk about it, because everybody wants a person to stay at home as long as they can. And it gets to, and you need socialization because you need to stimulate your, you know, your mind, and you need activities. And we have pushed that always with our assisted living facility. But when they're at home and not having a trained aide, sometimes they're sitting in the corner and it just doesn't work. So it's very important to know when, and Russ will talk a little bit about it. But let me talk about my buddy Todd, who he enjoys margaritas too. I got to tell you that. So I'm out in Florida, and in you know, the Shan Center and the Brain Center that they have there is a magnificent facility, just like the Moffitt, and which is associated with USF. But you know, the enjoyment was you have these clinical. Russ wasn't there, but the clinical people, and they're on one side, and then you have the scientists on the other side, like Todd, and they're having discussions going back and forth. And I remember the one where he said, "Smell the peanut butter." You remember it? Close your one nostril and take a whiff. But you know, it was just. I mean, I was in heaven because I'm sitting and listening to both of them. But Todd, you know, once he had that margarita and I could have my martini.